The Free State is one of 3 provinces currently seeing a rise in COVID-19 cases. The National Institute for Communicable Diseases is monitoring the situation. The institute says the April school holiday season, as it approaches, it's important to remain vigilant to minimize transmissions. Well, how is the Free State doing and what are the numbers really like? We are joined on the midday view on eNCA now via Zoom by the Free State Health MEC, Montseng Tsiu. Ma'am, good afternoon and thank you very much for your time on the midday view on eNCA. Other numbers we heard from the NICD the other day. I interviewed Professor Puren from the NICD. Says the Free State, the Northern Cape and the Northwest recently in the last few days they've seen the numbers going up. How are the numbers of new daily infections in the Free State?
The new daily infections started going up from the 1st to the 16th of April 2021, and indeed we have seen them going up in the 2 districts in Free State, that is Thabo Mofokeng and Mangaung. And these are fueled by the clusters of schools in Thabo Mofokeng, and in Mangaung Metro it's schools and also the family clusters.
So these are the only 2 districts that have contributed to the increased numbers in the Free State?
Yes, the other districts are increasing, but steadily. They are not really that bad. But with Thabo Mofokeng and Mangaung, we are really seeing the numbers really going really up. If I have to say, just for today, if I have to give you the statistics of today, you will then be able to see that indeed the 2 districts are the ones that are really giving us the big numbers. Other districts still, it's not like they are not
okay.
They are not growing, but this Mangaung, just for today, they gave us 92 new cases, and Thabo Mofokeng gave us 52. Indeed, as you look at the numbers, you may say they are not really that high. But with us, because we were used to getting the numbers that are below 100, but from the 1st and the 16th, we've seen the total numbers of Free State going above 200. And
is it only because of the schooling, the cluster there that you are talking about that's contributing? Are there other factors?
As we do the analysis, we've seen that it's the schools, but it's not just the schools. There are family clusters where people will be having family gatherings without really adhering to the protocols, not wearing masks and also not observing the social distance.
So what will be your key...
That is also one of the things that are really...
Yes, what will your key message be, your appeal to the people of the Free State about this surge now?
The appeal to the people of Free State is that we are technically in the 3rd wave as Free State. Our models have been telling us that we are indeed approaching the 3rd wave, and people must adhere to the non-pharmaceutical protocols because COVID-19 is not yet over. It does not mean that because we've started with the vaccine rollout, it means that COVID-19 is no more there. The relaxations of the protocols did not mean that there was no COVID-19 anymore. But we've seen people relaxing, and the issue of the fact that schools are now in full swing, and then all the schools are in full swing, and the tertiary institutions, that is also increasing the numbers in Free State.